Hello viewers, I am Dr. Abhijit Agashe from Manipal Hospital Baner as a Chief Joint Replacement Surgeon. Today we will be talking about hip arthritis and hip replacement. The commonest entity for hip arthritis is avian in our country, as many of you must be knowing. It is basically because of the cut blood supply of the hip bone, which leads to necrosis or damage to the hip bone, leading to arthritis. If the hip is already in stage 3 or stage 4, the only choice is a hip replacement. And yes, hip replacement can give you phenomenal results with a completely pain-free walk later after the hip replacement. With direct anterior approach, which is a muscle sparing internervous approach, post hip replacement you can go back to your normal activities like sitting on the floor or squatting. इससे फ़ायदा क्या होगा? काफ़ी सारे लोगों को पर्टिकुलरली यंग एज में जिन पेशेंट्स को थोड़े स्पोर्ट्स एक्टिविटीज़ करने, with a direct anterior robotic hip replacement you will be able to go back and do your normal routine activities as before. So if you have hip problems and wish to know more about it, I request you to contact us. Thank you.